Okay, so now we're going to go through the syllabus of the course, where a lot of the policies for the class can exist in addition to the handbook, which we're going to go through next. So to get to the syllabus, like with all of our courses, if you navigate the simple syllabus, it will take you to the most updated version of that. Depending on which section you're in, you'll see different contact information for your instructors. So I'm the lead. You'll see me across all of them. I'm available to you guys. Please don't hesitate to reach out to me if you have any questions or concerns. There are some students in the course who I am your assigned instructor. Hmm. But others of you guys will have other instructors. So we have Laura, and she is over section 2. And then we have Camille, and she's in section 3. And then Robert and myself are in 1, 4, and 5. So if you have either 1, 4, or 5, you'll be working with both Robert and me. We're really close in this class, just like with fundamentals. So you might, for your check-ins and such, and we'll go through what those check-in appointments look like, but you'll be either meeting with me or Robert, depending on when you schedule yourself. Of course, we have our contact information. Our preference is 100% to please message us through Canvas, right? Like there are emails there, but they get so full and filled up with other things from the college that it's not unheard of that we miss a message that might come through. So start with Canvas first. We also have phone numbers here. If you need to get a hold of any of your instructors, you can text them on this phone number if you need to get a response back in less than 24 hours, right? So if it's an emergency or you're really stuck, you don't know what to do, haven't heard back from Canvas, because with Canvas, we still have that 24 to 48 hour turnaround time. If you need it faster than that, text us on these numbers first. Please don't call. If you do call, we'll probably just let it go to voicemail, and then if, when we get to the voicemail, we'll get back to you, but it'll be a lot quicker if you just shoot us a text, or the next would be, for primary would be to message us in Canvas. Hmm. The Canvas navigation video, which you guys will see in a little bit going through the orientation module, that has a how-to video for booking an appointment with Robert or myself within Canvas. Or it's a booking appointment thing through Microsoft for Robert and I, because we're over so many sections. So kind of it confuses the calendar system within Canvas when you're not only on just one section. So you're gonna see the difference there. If you have Camille or Laura, you'll book through the Canvas calendar appointments just like you did with your ISPs or your pass-offs for some of your clinical judgment courses. And then if you have Robert or myself, you'll book through the appointment calendar through Outlook, basically. So prereqs for this course, you had to have gone through all of your other courses prior to. We do have a co-requisite to this class. That is the transitions course that is taught by Candace. So, as with all of the co-recs, remember, if you don't pass one, you by default do not pass the other. Please make sure you keep up on your coursework and transitions so that you stay on track with both of these classes. Candace and I have worked hard together to make these courses very complementary, right? So as you move through your capstone and as you navigate through your transitions, sorry guys, that makes sense, right? They kind of talk to each other. Learning outcomes, those are there. Here's our engagement, right? So we'll be meeting virtually via Zoom with your assigned capstone instructor. We'll do that at a minimum of 3 times. If you need more, we're more than happy to set up those appointment times with you and to make sure that you're progressing well through the course. And if you have no questions, or if you do, we can get you answers. And then just like I talked through earlier, Canvas is preferred. You can, but our preference is really that you don't, if you can avoid it. And then our phone. So same thing up above, preferred text for urgent matters. If you can, if we don't answer right away, if you called, leave a message so we can get back to you. And then we try to respond within 24 to 48 hours during the weekday. And then over the weekend, we'll get you back to you on Monday, typically. I will tell you this though, um, every instructor who's been assigned into the capstone course, we're just really available to you guys. Please don't hesitate to reach out. We really want to support you, help you navigate through this. We know that some of you will be working on the weekends and nights and holidays and breaks, right? So the really try to get on top of communicating with you in a timely manner and getting back to you. If you've messaged your primary assigned instructor and you don't hear back from them within, 48 hours, then you can reach out to me as the course lead. Absolutely is what I'm here for, is to help for anything. We want to keep you guys um, moving in a steady progression to getting those 100 hours done in a timely manner successfully. So, how to succeed in this class. The best thing to do is just treat everything in this class like a checklist. You guys will have and should print out the handbook, and I designed it so you can just cross it out, right? Like you see the task item, complete the task item, cross it off your to-do list. And if you follow that handbook, you should have no problems walking away with this class, and you stay engaged in the capstone course, and you stay engaged at your capstone clinicals. That's really important. And you keep, putting in a solid effort. You shouldn't have any problem successfully passing this course. But to prep, you have to complete the Canvas orientation module before you start clocking any capstone hours. Read through all of the information, watch the videos, take the quiz. You have to get 100% on that quiz. And that has key information about how to successfully navigate your capstone. Okay. You're going to reach out to your preceptor, exchange information, develop a schedule for your 100 hours. You're going to turn in your schedule into Exact. There's a video that walks you through how to do that later through the orientation module, and you can update that as you go through. Don't submit it to review. You're just going to submit your hours and you can review them all at the end. Okay. Throughout the capstone experience itself, maintain a high level of professional conduct. Okay. A lot of times, if they have room available for you and you perform well during your capstone experience, it is very common for our students to be extended an offer on their capstone placements. It's not a guarantee. There's a lot of there are, circumstances where units are have the capacity to be able to facilitate a capstone student, meaning that they'll assign you a preceptor for 100 hours, but they might not have an opening available on their floor for a new grad nurse, right? So if it doesn't turn into a job offer, just continue to push forward and treat it like a potential job interview. Because even if they don't have a place for you at that specific unit, you might get a referral through to another unit, through the managers or through educators or through your preceptor. But you have to show up and put in the effort and just be a sponge and continue to push towards gaining independence and transitioning into that professional practice. Make sure that you stay respectful and collaborative with your preceptor and the healthcare team. And you have to wear your correct student badge and the correct student uniform. Please do not show up to the unit with um, a hoodie on or a beanie and a hat, and that's what you wear for the whole shift. Just wear your uniform scrubs, wear your badge. Bring your stethoscopes and your assessment equipment if you have it. And bring your assignments for the Canvas course, for the capstone course, I apologize. And just be ready to get in there, learn from your preceptor, and mean what it is to, on a singular unit, build out that skill set that you've been kind of piecing together as you've gone through nursing school into patient care at the bedside. Okay. You have to be fully compliant in Complio. Please make sure that you are fully and compliant before you step foot onto any healthcare facility site. You have to make sure that you have Complio done. You need all of your clinical site forms and trainings. And make sure you understand the policies listed within the handbook and then with the syllabus itself. Okay. If you go not in compliance, like if you go and your CPR is not gonna last the whole semester, or if your TB is going to lapse while you are going through your semester, get compliant before you go, because it may result in course failure if you attend, because it puts us in a bad standing with our clinical sites, and they may not grant us placements again in the future. We already spoke to the communication piece, but the one thing we didn't really talk about was when to notify your instructor. So, of course, questions or concerns regarding your capstone experience. We're here to support you and help you navigate through this. If you're ill or if you need to reschedule a shift, it's mostly just to say, hey, I'm not going to be there, but I let everybody know who's going, who needs to know, and I'm working to reschedule it. I don't need to know why. I don't need to know when. The only time that would be is if you're going to be missing like multiple shifts, and then the concern is that you might not be able to get all your hours done. Then let us know, please. If your preceptor is unavailable, but we'll talk about what to do in those situations when we go through the handbook itself. And then another thing too, if at any time you think that you are going to have difficulty completing the 100 hours in the assigned time that you have been allotted for your capstone experience. So I'm sure many of you have looked on Exact. There are effectively a few different block dates that our host sites will give us and say, this is when this student is allowed to complete their capstone hours. This is the date window. Each facility is different, and so because of that, it's a random spot placement unless you have like an RNA or something of that nature. Um, but whatever the dates are in Exact, that is the window range in which you can complete your capstone hours. Okay. You need to have the access to the handbook. It's available in multiple ways. So make sure that you, oh my gosh, I apologize. Make sure you guys are printing out the section that applies to your hour length for your shift and the little beginning piece. And like I said, it's a to-do list. Just follow your to-do list and you'll be successful with this course. So as a breakdown of what the class looks like, you have a syllabus and handbook acknowledgement, handbook orientation quiz, and then a unit orientation assignment. The unit orientation assignment is where you'll get familiar with the unit itself, and you will be looking at the policies and the layout of the unit, like where are the med rooms, where's the dietary closets, and what are the codes that you might hear overhead that they're called in those facilities. Not all of those questions will be applicable to the unit you're on. So it's mostly just an assignment where you get familiar with where you're going to be completing the remainder of your hours. Okay, just one second. Sorry about that. My child thought it was kind to share a cold with me. So that's what I'm dealing with. Okay, so then you have reflection journals. So you have, depending on the shift length, you'll be XYZ number of journals, XYZ number of preceptor evaluations. You have 3 capstone check-in meetings, like we mentioned before. So the first one, it's early in the experience. It's to say, hey, how are you doing? Are you set up for success? Is there anything we should be worried about right now? How are you feeling? And basically just make sure that you're on the right path for completing your capstone successfully. Then you have a midterm, which is your second check-in, and that's about halfway through with your preceptor, your instructor, and yourself. And then the final, which is at the end of all of your 100 hours. You have a capstone schedule and timesheet, and then just making sure that all of your evaluations and stuff are signed by the end, oh my gosh, of the capstone experience. So the other piece that is a component that you guys might not have experienced to this degree in the course yet, apologize, I mean in the program yet, is the professionalism points. Now, professionalism points, you start with, I believe, 300 of them. The breakdown is a little bit further. But effectively, we're just making sure with these professionalism points that we're helping you mimic the behaviors that will help you be successful transitioning into that professional environment. So these, when you have certain infractions, I guess is what we will call them, you'll start to lose some of these these professionalism points. So grading, there's no grading, rounding of any grades. Late work, really, we deduct off of your professionalism points, and that's outlined a little bit below. We follow the same grading scale. You must have a 78% in the class to pass. And then here's the breakdown. So 5% is for your evaluations, 5 is for your reflection assignments, 30% your meetings, 20% is your evals, 35% is professionalism points in this course. So they're heavily weighted because they're important. And then 5% for your other required assignments. So we'll start first with the reflection journals and the evaluations of student progress assignments. Everybody will Not everybody, but there are varying lengths of shifts that occur throughout the capstone experience. Some of you will be assigned places that typically have a 12-hour shift. Some of you will be assigned places that have an 8 or a 10 or varying. Like we've had, for example, somebody who has done a home health rotation, and their hours of their shifts depended on how many patients they were going to go see for the day. So sometimes they had 3, sometimes they had 10 hours that they were clocking. Effectively, we do have that breakdown of how many you need to turn in for each of these two categories in the handbook, but they're all or nothing points. So you either turn in all of the preceptor evaluations and all of the journals and you'll earn all 50 points, or you don't and you won't get any of them. So case in point, many of you will be doing a 12-hour shift, which would be 8 evaluations and 8 journal assignments. So if you turn in 8 journals, you'll get all 50 points. But if you only turn in 7 evaluations, then you'll get 0 points in that category. So just make sure you follow your to-do list, turn them in on time with when you're doing your check-ins, and just keep up on it so it doesn't become a last minute thing. We spoke about the how many you're doing. Now you have your check-in meetings. The capstone orientation module, what's worth 50 points, totally independent. That's you by yourself, and that's you doing the quiz. And then you have your first, second, and third check-in, which I spoke about a little bit earlier. Now, the evaluations, you get 50 or you get 100 points for the midterm, 100 points for the final, and then you have your other required assignments. So your schedule, your acknowledgement form, and your unit orientation, those are only 5% of your grade. Now, the professionalism points, those are worth 35%. So we'll talk about what that is a little bit later. Before I go any further, I do want to talk about what the scale on the midterm evaluation and the final evaluation is as far as how you're scored in your categories for what we're evaluating, which ties back into the course learning outcomes. You have to complete a midterm and you have to complete a final. If you don't complete a midterm evaluation, you may be at risk of failing the course. The number of points that are attached to it would pull your score down dramatically. So it's really important that you have these check-ins on the timeline that they're scheduled. Now, in the midterm evaluation, there are three categories as far as ratings on where you can get scored. There's satisfactory, there's needs improvement, and there's unsatisfactory, and then there's also not applicable. We recognize that there are some things that you will do on a regular basis in some types of placements. So, for example, of what I mean by that is doing a S-bar with a provider, right? If you're on a med surg floor, that is a very common thing that you're going to encounter. Where that might not be very common, even in a hospital setting, for example, might be a labor and delivery unit. Those units, while they do communicate with providers, it's usually in an emergency situation or when things aren't going so well. But they have so many protocols that they follow with standardized order sets that they just follow if this scenario occurs, then do this, that they don't always have to reach out to providers to execute those things. So there are some places, so some things where not applicable is totally appropriate for you in those categories. Now, if you receive a needs improvement or an unsatisfactory in any course on the midterm, what that is telling us as instructors and is letting you guys know as students is that at that time, you're not meeting the course outcomes and you're at risk of failing the class. So in order to prevent that from happening, you have to move those needs improvements or unsatisfactory up to the satisfactory by the final evaluation. We have not had any problem with the student doing this. It's not uncommon for students to get some sort of to potentially receive a needs improvement at a midterm evaluation, because there are always categories that we can work to just kind of strive and push to become better at. So don't be overly concerned if you get a needs improvement on your midterm evaluation, except in these four categories. Okay, these ones you have to get satisfactory on from the very beginning, all across the board. You must perform nursing skills and procedures safely. You have to administer medication safely. You have to arrive and leave your clinical at the designated times. If you're arriving late and you're leaving early, you're not getting your 100 hours that are required for the course. You have to show up on time and stay the whole time. And then you're attending your clinicals as you have scheduled them. Now, I'm fully aware that there might be a time where you are sick or a family emergency happens, right? This would be if you were a no call, no show and everybody at the unit was planning on you being there and you just didn't show up and didn't tell somebody that you weren't showing up, right? So there's differences of what that means for your clinicals as scheduled. It's just making sure you're getting your hours all completed. Otherwise, you wouldn't pass the class. If you receive a U in any of these categories, it may result in an immediate course failure. We have to be safe. We have to be attending our shifts. Okay, that's really why those four categories have to be at satisfactory. Everything else we can work on and have needs improvement on. Now, the final, oh, let me back up. If you get a needs improvement, then your instructor will talk about strategies on how to improve your rating in those score areas so that you can go from needs improvement to satisfactory by the end of the capstone experience. Just one second. Sorry about that. Okay. They'll give you information about like how you can improve, tips and tricks, things that they've tried or things that they've seen to help them in those areas with their practice. And that will effectively be serving as your performance plan for improvement. Okay, so they'll give you the tools and conversations to help improve in those areas so that they go from needs improvement to satisfactory by your final. Now, on the final evaluation, you have to complete a final evaluation. If you do not, you might be at risk of failing the course, just like the midterm, right? Those two check-ins are critical for your success in this class. If you have any unsatisfactory mark on the final evaluation in the course, it means you're not meeting the end of course outcomes. So that would result in a failing score in the course itself. So other ways, if you don't get the 78%, that could result in a failure of the class. If you don't get all of your 100 hours in, then that's the big requirement of the course is getting those 100 hours. And then if you have a failure to follow the policies listed in the capstone handbook, that can result in disciplinary action up into including failure of the course. Just to note, guys, if you have reported safety, compliance, attendance, or professional conduct concerns, as with any clinical class, this could put you at risk of course failure or program dismissal. That hasn't changed as you guys have gone through the program. It just is all that's where it is housed is in this semester is within the capstone class, and then of course your lab. So here's the professionalism points. This you start with 350. So as we go through the course, if you have these infractions, then that's when we'll start just deducting points away from you guys. And here's the list of the infractions off to the left, and then here is the points deductions on the right-hand side. So if you miss a self-scheduled check-in meeting or you're late by more than 10 minutes, then it would be a 25-point deduction per event. Okay. Um, Timeliness is super important. If you're late for work, you get written up. If you're late 3 times for work, you could get fired. The healthcare systems here in the valley, anywhere really, take timeliness as a very important piece of measurement for your guys' evaluations and keeping you guys employed in those facilities. As far as the scheduled check-in meetings go, you're booking those check-in meetings. Your instructor's not telling you when you have to show up, you're telling us when we have to show up. So if you schedule a check-in meeting and then you do not show up or you're late by more than 10 minutes, a lot of times we have these scheduled back to back. And that would, if we facilitated to continue to facilitate that meeting, one, we wouldn't have time to be able to discuss what we target to talk about with you during those check-ins. But then two, if we did and we kept going, there is a high likelihood that then that meeting would bump down into the next scheduled student's meeting appointment, which isn't fair to a student who is on time and who is prepared and ready to be there. Now, I will tell you that I understand that things happen. Like if your check-in meeting is scheduled because you're at a shift, and that's because your preceptor wants it to be, and then you have like a patient who has a code blue or something like that. Like we get it. It's the ones where it is forgotten or not communicated, right? Communication is key in this class. I can't help you if I don't know that there's a problem, and neither can any of your other instructors. So please just make sure you have good communication with your instructor, with your preceptor. You let us know what's happening so we can work with you. But that would be the first category, okay? Okay, the next one is if you can't attend a capstone check-in meeting or you rescheduled it and then you didn't notify us, we would like at least a 6 hours notice. So if you get into your shift for the day and you're like, oh my gosh, we were planning on it and we are busy. We were behind before we even got here and we didn't even know it until we got report. Okay? Make plans ahead of time and be able to just shoot off a text to your instructor and say, hey, I had a meeting scheduled today, but it's probably not going to happen. Again, communication is key. So the next piece is if you do not attend your capstone check-in meetings within the time frame outlined in the handbook. We're going to go through what those timelines are. There's a good amount of flexibility with as far as like the dates or the shift ranges that you can do it in. Here's what we were having happen with our students is we would have a student who we would see two meetings scheduled back to back, like on a Tuesday and then on a Wednesday. And we would think that it was an error on our side or that a student just maybe double booked unintentionally. So we hop on the meeting on a Tuesday to find out that we're doing the midterm evaluation with a student and all of their shifts are done. All 8 or all 100 hours, and they're trying to hold a midterm evaluation. Okay. There's no way for you to improve if you have a problem and you didn't have your midterm at that time. So it's really important we follow that so we can make sure that you're progressing through the course successfully. That's where it kind of ties in with the previous policy up in the syllabus where if you miss that midterm evaluation or if you miss that final evaluation, you may be at risk of failing the course. The next one is if you don't turn in your assignments 6 hours prior to your check-in meetings. Okay. The purpose of the check-in meetings is to give you feedback on how you're doing and to make sure things are progressing in a good way for you so that you're successful with the class. If we don't have those assignments so that we can prepare for that meeting with you, it's a moot point to even meet. We might as well not even have that conversation because then there's nothing for us to talk about and see how you're doing and checking in. So really make sure that you keep up on your assignments. Do a shift, turn it in. Do a shift, turn it in. So you stay on track with that. We give you 6 hours prior to that meeting to finish filling out those assignments and turning them in. Okay. If you do not, it'll be 10 points per missing assignment. So, for example, let's say that um, you were doing your first check-in, okay, and you'd gone to two shifts, so you needed two journals and two preceptor evaluations, and you needed your timesheet turned in. If you, and your unit orientation, if you did not turn in a journal and you did not turn in one of your preceptor evaluations, then we would deduct 20 points from your professionalism category. Okay. If you fail to submit your capstone chime sheet prior to starting your capstone experience, 10 points will be deducted. And if you fail to update the capstone schedule as you go through, then we'll take away 10 points. If we notice that there is a misalignment with the shifts that you say you're working versus the days that you actually went to the capstone shift. Okay. As far as the capstone schedule and why it's so important, okay, when it comes to scheduling your capstones shifts, you're scheduling those with your preceptor. We don't schedule your capstone shifts for you, which is different from what you've experienced with your clinical shifts previously, where we just said you're going to go here, you're going to be on this unit, on this day, at this time, and then an instructor is going to let you know when to show up, and they're going to facilitate that day. We don't do that with your capstone class. You will get in contact with your preceptor, and you're going to ask him for their schedule, and then you're going to compare their working schedule to your availability schedule. And whenever the stars align, they're working and you're available, you're going to book a capstone shift. Okay. Now, because of that, we do not have, unless you give it to us, an updated schedule about where you are at. Now, importance of this, if something's happening at a facility and you are there as a capstone student, then we need to know so we can get in contact with you. Okay. Prime example, and this happened many semesters ago, but the University of Utah had a bomb threat happen on one of the units. As soon as we got word that there was a bomb threat, an active bomb threat at the University of Utah hospital, I got on the phone with Zach, who was our clinical coordinator at the time, and he and I went through all of our time sheets for all of our capstone students who were assigned to the University of Utah to make sure that if you were there, our next step was to give you a call, make sure you're safe, and get you off campus. You did not need to be there while that emergency was happening. Okay. So timesheets are super important. They're the other way is that we verify your guys' 100 hours was all completed so that we can prove to accreditation and to licensing agencies and say, yes, this student completed all of their required hours that was for the course. And here is the proof with their timesheet that they completed and submitted. Okay, so that has to stay updated. Just make sure you follow this outline. It's really turning your assignments in on time, showing up on time, and scheduling your appointments on time. And that's the bulk of their professionalism points. As always, academic integrity, please, we want to make sure that we do not have any dishonesty or academic dishonesty in this class. Falsifying documentation of submitted timesheets for capstone hours is considered academic dishonesty and will be subjected to the academic integrity code of the college itself. Now, as far as the assignment due dates, sometimes this is where students can get a little confused is because the due date is all the way at the end of the semester for a bulk of the assignments. But that's not when the assignment is due. The assignments are due as you progress through your capstone hours, and it's outlined in the capstone handbook when those assignments are due. So effectively, you create your own due dates when you go to your capstone shifts, okay? They're all the way open until the very end because some of you have different block ranges of when you can complete your capstone hours by. So open for the whole semester, but it's due as you go through your capstone shifts. Follow your to-do list in the handbook. You'll be just fine with if you follow that to-do list. Of course, there's this how to navigate the Canvas if you're not familiar with it yet. We have our institutional policies, learning and tutoring services, ADS services if you need anything, our academic calendar. And then for any additional policies, please refer back to the nursing program handbook if you would, if you have anything for the appeals that you would like to do. That's a new policy or process for us, but it's listed in the handbook. Okay. The biggest piece of advice I can offer you guys, communicate, communicate, communicate. If you're in communication with your instructors, you should have no problem being successful in this course, okay? We're going to go through the capstone handbook in the next video, which is the bulk of how to navigate through this class.